Hello fellow pharmacist, studies showed that proactive monitoring of laboratory parameters performed by Pharmacist can reduce diabetes-related complications by up to 30%. Today, I'll discuss the top 5 clinical parameters you must monitor in diabetic patients to optimize care and prevent complications. Why laboratory parameters monitoring is critical. Diabetes is a chronic condition that affects multiple organ systems. Poorly controlled diabetes can lead to serious complications such as cardiovascular disease, kidney damage, and neuropathy. Even small variation in glucose can significantly affect patients' outcomes. As a pharmacist, we play a crucial role in monitoring certain laboratory parameters consistently and helping to prevent long-term complications of diabetes. Let's dive into the top 5 parameters you should track. I'll begin with the most fundamental laboratory parameter, blood glucose. We typically assess 2 main values, fasting blood glucose and postprandial blood glucose level. Fasting blood glucose is defined as no calorie intake for at least 8 hours, reflecting baseline glucose control. While postprandial blood glucose is a blood glucose level 90 to 120 minutes after a meal, indicating how the body responds to food. For non-pregnant adults with diabetes, the recommended fasting blood glucose target is 80 to 130 mg per deciliter, while the postprandial glucose goal is typically less than 180 mg per deciliter. Maintaining these blood glucose values within target ranges is crucial. This is where pharmacists play a vital role. By regularly monitoring fasting and postprandial glucose, you can assess the effectiveness of basal and prandial therapies, detect patterns of hyperglycemia or hypoglycemia, evaluate adherence and technique, and interpret daily variability in relation to HbA1c trends. Now let's move to the second key laboratory parameter every pharmacist should monitor in diabetic patients, HbA1c, or glycated hemoglobin. Unlike daily glucose checks, pharmacists should know that HbA1c reflects the average blood glucose level over the past 2 to 3 months, making it a vital marker in diabetes management, beyond day-to-day fluctuations. When it comes to HbA1c, a reasonable goal of therapy for most patients is maintaining an A1c value below 7%, or 53 millimoles per mole. However, you should always consider patient-specific factors. This value may be relaxed in elderly individuals or in those with multiple comorbidities. For example, in older adults with diabetes who have very complex or poor health, an HbA1c goal of less than 8.5% is considered acceptable. In terms of monitoring frequency, HbA1c should be obtained at least twice yearly in patients who are meeting their treatment goals and maintaining stable glycemic control. For those whose therapy has recently changed or who are not meeting glycemic targets, the HbA1c test should be done every 3 months. A value above target indicates persistent hyperglycemia, which increases the risk of diabetes complications. As a pharmacist, HbA1c is one of the most powerful tools we can use to evaluate long-term diabetes control in 4 key situations. Number 1 situation is monitoring HbA1c in newly diagnosed patients starting anti-diabetic therapy. Here, HbA1c provides a baseline, helping us understand the patient's starting point and anticipate how well the initial treatment is working. Second situation where pharmacists should monitor HbA1c is for patients who have recently had changes in their anti-diabetic regimen. In this scenario, HbA1c allows us to assess whether the medication adjustment is effective and whether the patient needs additional counseling on adherence, dosing, or lifestyle modifications. Third situation is patients under ongoing treatment for long-term diabetes management. Regular monitoring of HbA1c among these patients let us track this value over time, ensuring the patient remains within target goals and reducing the risk of chronic complications. The last situation where a pharmacist plays an important role is monitoring of HbA1c among patients suspected of poor adherence or therapy failure. Sometimes, blood glucose readings alone don't tell the full story. HbA1c helps uncover hidden issues, whether it's missed doses, suboptimal technique, or insufficient therapy, so we can intervene proactively. Integrating lipid profile test monitoring into routine practice is essential for diabetic patients, as lipid abnormalities are common in those with diabetes. We must remember that abnormal lipid levels can silently accelerate atherosclerosis and increase the risk of heart attack and stroke. A standard lipid profile includes 4 key parameters. 1. Total cholesterol should be below 200 mg per deciliter. 2. LDL cholesterol, the bad cholesterol, target is less than 100, or under 70 mg per deciliter in high-risk patients. 3. HDL cholesterol, the good one, above 40 in men and 50 mg per deciliter in women. 4. Triglycerides should be below 150 mg per deciliter. Pharmacists should recognize that any abnormalities in these values can increase the risk of cardiovascular disease, even when blood glucose is controlled. How often we should screen lipid profile test? The American Diabetes Association recommends screening for lipid disorders at the time of diabetes diagnosis, at an initial medical evaluation, and thereafter every 5 years if the patient is under 40 and annually if the patient aged 40 and older. As a pharmacist, regular assessment of lipid profile allows you to screening for dyslipidemia to spot abnormal lipid levels before complications develop. Evaluating a lipid-lowering therapy effectiveness to ensure we achieve the treatment goal. Identifying potential drug interactions, especially with fibrates and other lipid-lowering agents. Educating patients on diet, lifestyle, weight loss, and physical activity. Now let's move on to the 4th important laboratory parameter, serum creatinine. Serum creatinine is a key indicator of kidney function. In patients with diabetes, regular monitoring of renal function is extremely important, and pharmacists should remain particularly vigilant about this parameter for several reasons. Number 1. Screening for diabetic nephropathy. Chronic hyperglycemia can damage renal nephrons over time, leading to diabetic nephropathy, a major microvascular complication of diabetes. Number 2. Detecting drug-induced renal impairment. Some antidiabetic medications may adversely affect renal function, making serum creatinine monitoring vital for early identification of nephrotoxicity. For example, cases of acute kidney injury has been reported with use of sodium glucose contransporter 2 inhibitor. Number 3. Guiding renal dose adjustments. Pharmacists should assess patients' renal function using the estimated glomerular filtration rate and intervene by adjusting or discontinuing medications accordingly. For example, when the estimated glomerular filtration rate is between 30 to 45, the dose of metformin should be adjusted accordingly, with close monitoring of renal function. However, if this value falls below 30, metformin is contraindicated and should be discontinued in the patient. And finally, let's talk about the 5th laboratory parameter, liver enzymes, including ALT, alanine aminotransferase, AST, aspartate aminotransferase, ALP, alkaline phosphatase, and GGT, gamma-glutamyl-transferase. There are several reasons why pharmacists should remain vigilant about these enzymes in diabetic patients. 1. Detecting metabolic dysfunction-associated steatotic liver disease, formerly called non-alcoholic fatty liver disease. 2. Monitoring for drug-induced hepatotoxicity. To ensure safe pharmacotherapy, pharmacists should review liver function tests before and during therapy. There are anti-diabetic medication can affect liver function. For example, troglitazone, an anti-diabetic medication, was removed from the market in the United States and United Kingdom because of reports of severe hepatocellular injury, resulting in death or the need for liver transplantation in some patients. Although similar hepatotoxicity has not been observed with rosiglitazone or pioglitazone, based on the troglitazone experience, the US FDA currently recommends that patients receiving pioglitazone or rosiglitazone undergo baseline liver biochemical testing followed by periodic monitoring of liver function based upon clinical judgment. The third reason is, if liver enzymes are significantly elevated, pharmacists can assist in evaluating whether medication adjustments or discontinuation are warranted, in collaboration with the healthcare team. So these are the top 5 lab parameters every pharmacist should monitor in diabetic patients. Remember, good monitoring is not just about tracking numbers, it's about improving patient outcomes. Thank you for watching. If you found this useful, consider subscribing to my channel for more clinical updates and practical tips.